You're used to take medications when you run. You take an ibuprofen because it's going to take care of the soreness later on. Be careful. Ibuprofen, naproxen, has a bad habit of constricting the renal artery. What that means, decreases the blood flow to the kidneys. Therefore, you can injure your kidneys. Okay? So, and second, if you have an injury, and if you know you're going to ache, if you take that ibuprofen, you are running numb. You are running masking the problem. Okay? That is going to get worse. And one of the things that I do that is my subspecialty is pain management. When I see folks using medication to do a normal life when they have an injury, they take much longer to heal. Most of the time they get actually worse. Okay? Because they don't have, the pain is your friend to protect you, to allow you to do how much you can do. Okay? So what can you do? Find out what the problem is, and if you have to choose, should I stretch or should I strengthen? Strengthen. Okay? What stretch does is to allow you to have better recovery. You stretch a tired muscle, increase blood flow, you recover better, you recover faster, you get stronger, you get better. Okay? But in terms of injury, to really prevent injuries, strength is the key. Okay? And unfortunately, that is one muscle group that we wear a brace on it all day. Okay? So when you sit, you're wearing a brace on your glutes. So when you get up and you start running, as soon as you do your heel strike, that force transmits straight to the hip so you don't collapse. Okay? You don't have a strong hip, you're going to overload the knee. We see that quite more often than not. Okay, so when you cross, the hip drops, the knee has to compensate, and then the forces on the knee is much greater, and end up developing injuries with that. It's the first thing we do. You have a knee problem, we strengthen the hip, the problem goes away. It's beautiful. It's phenomenal. Okay? So keep that in mind. If there any muscle group that our runner has to work, okay, it would be hip, 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 and then core. You can't do the hip without core, right? So it's this one and this one, okay?